So, the most common question I get, believe it or not, is what is a vascular surgeon and what does a vascular surgeon do? And interestingly, that question is not just posed by patients and lay people, but it's actually posed by other physicians. It is probably one of the least understood specialties in terms of what it is that we do. A lot of that has to do with the history of the origin of vascular surgery, which I won't go into. But the truth is that many people don't know what it is that we do. And so the definition of a vascular surgeon is a physician that is trained in the diagnosis and management of all conditions involving the peripheral vascular system, including arteries, veins, and the lymphatic system. Now, that's a kind of a fancy explanation, but what it really means is that patients who have either blockages in their arteries or arteries that have gotten too big, what we call aneurysms, and the consequences that occur from those, we basically treat those. It also means that patients who have problems with their veins, whether it be veins that don't work normally because of the valves that don't work or veins that are blocked off, we treat that as well. The lymphatic system is a system that involves the clearance of fluid from the tissue, and when that doesn't work, patients end up with significant swelling in their lower extremities. We are also trained to deal with that. I think the most important thing about what a vascular surgeon does, that honestly becomes more confusing than anything else, is that we treat those conditions, and in the vast majority of times it does not require surgery. So although we are called vascular surgeons, probably the better name would have been vascular specialists in our origin. Now, because we do surgery, and that was the most intense aspect of what it is that we do, that name just came and it stuck. Our origins as vascular surgeons are as general surgeons. So historically, we train as general surgeons, and then we go out and do extra training in the field of vascular in order to learn the skill sets to take specific care of patients with these particular conditions.